U.S. action follows WHO's announcement Thursday that the 2019 outbreak is a public health emergency of international concern, or PHEIC, and occurs on the same day that the CDC issued a federal quarantine order for 195 U.S. citizens who recently returned to the United States from China. This order is part of an aggressive public health response to minimize the spread of this new virus in the United States, said Dr. Nancy Messonnier, director of the National Center for Immunization and Respiratory Disease of the CDC. As part of the announcement, any citizen who returned to the U.S. respiratory infection, closely linked to SARS and MERS, has spread throughout China and cases have been diagnosed in several other countries, including the United States. The Chicago Department of Health reported that she went to China in December and returned to Chicago earlier this month. The CDC's decision follows a quarantine imposed by Riverside County, California, after one passenger attempted to leave the March Air Base on Wednesday morning without being released by health authorities. 2020. News of a coronavirus outbreak that began in Wuhan, China, is developing rapidly. The eighth case occurred to a 20-year-old man in Boston who had just returned from Wuhan. According to the Massachusetts Department of Health, the Department of Foreign Affairs issued a Level 4 warning to advise people not to go to China because of an outbreak of the epidemic. The U.S. Department of State issued a Level 4 warning to advise people not to go to China because of an outbreak of the epidemic. The Arizona Department of Health said the patient is a resident of Maricopa County and a member of the University of Arizona community who does not live in a hospital. He is isolated in a local hospital and is in good condition. According to the Orange County Department of Health, a new case published in the New England Journal of Medicine describes how a Chinese woman infected 4 employees of a German company before she developed symptoms of the disease itself.